Hello and welcome to the program, everyone. I'm Layo Adegoke. Medical officials say the 2 cases of suspected coronavirus in Ghana have tested negative in the capital, Accra. The suspected cases involved 2 men, a Chinese national and an Argentine national, who lived together but traveled on different dates from China. They reported themselves to the emergency unit of Kolebu Teaching Hospital on Wednesday after being turned away from an unnamed private-owned clinic. The Secretary of Ghana's Medical Association in Accra, Dr. William Ba, says both patients have been quarantined as their blood samples have been analyzed. Joining us now is Fred Smith, a Ghanaian journalist, to discuss more on this. Thank you so much for speaking to us. I'm sure Ghanaians are heaving a sigh of relief as the test results have come back negative. But one is never too careful if there is an eventual outbreak in Ghana. How prepared is the country for this? All right, seems like we'll have to get back to Fred Smith. But moving on, Uganda's Ministry of Health saying over 100 people who arrived at the Entebbe International Airport from China have been placed under a 14-day quarantine to prevent the spread of the coronavirus. According to the Minister of Health, 44 of those quarantined are Chinese nationals. Dr. Jane Acne in the capital, Kampala, said the ministry was not aware of any Ugandan who is either suspected or confirmed to have the coronavirus. The country has intensified screening at its major border points and made it mandatory for all travelers from China to provide personal details for follow-up visits by health workers. The government says there are hundreds of Ugandan students in China, but there are currently no plans to evacuate them. Now we have Dr. Clemens Peter, the WHO Director in Abuja, joining us now to discuss more on the coronavirus. Thank you so much for speaking to us.
Thank you. You're welcome.
Yes, sir. Ghanaians are heaving a sigh of relief as, the test results have come back negative. Also in Kenya, it was a negative result from the test result they had. What do you think other countries, in Africa should do to prepare for this?
Thank you very much. First of all, I'm happy that there is no country in Africa that has confirmed coronavirus so far. And what is required for all countries in Africa is preparedness. The declaration of the emergency as public health emergency of international concern is to ensure every country is prepared so that we're able first to detect the cases should it happen. And in case it happens, we'll rapidly be able to control them.
All right. As it stands, Egypt is the only African country that has evacuated its citizens from Wuhan. Kenya initially said it wasn't going to evacuate its citizens, but said, okay, when Wuhan, lifts the lockdown from their city, they would evacuate their citizens. Do you think other countries should do the same?
I think there is no cause of panic at this time because the government of China is also taking all necessary steps to control the disease. What is important is ensure that we really comply with the registered medical advice to, 1, minimize the contact with people who are sick, 2, ensure that we maintain the hygiene, the aspect of hygiene, and ensure that we don't expose ourselves to potential threats because the risk is considered to be high if we are close to people who are infected, if we ensure that we don't protect ourselves because the disease is spread by droplets. So if we have to cough, definitely we need to ensure that we protect ourselves and protect others. So there should be no cause of panic because the government of China is doing everything possible to control the disease.
Yes, indeed, the risk, like you said, is high. But are you happy with the level of preparedness in Nigeria and, other West African countries and even the continent at large?
Specifically, I can speak of Nigeria. There is a lot of efforts that the government is doing with support of its partners. As I speak now, definitely there's a capacity to confirm should we have any suspected case in Nigeria. There's also a minimum capacity to be able to isolate if we have a case in the country. The government is working hard with the support of partners. As I speak now, there are also other experts who have joined the government in ensuring that there is a minimum capacity for Nigeria to be able to remain safe. So this is happening, and it's the same in Africa. The WHO has classified the countries into high priority countries, almost 13 of them, because of the relationship with China and the high volume of movement of people between China and these countries. So these countries are prioritized. It is important that they have the minimum capacities to be able to detect and respond to any importation of case.
All right, then, Dr. Clement Peter, the officer in charge of WHO in Nigeria, thank you so much for speaking to us on Network Africa.
You are welcome.